Just a short video to talk about lip rejuvenation. It's a popular topic nowadays. Lip rejuvenation is something that can be done safely. There are different ways to accomplish it. Number one is you can do lip augmentation. There are definitely different ways to accomplish that, some which I think work, some which I do not recommend. First of all, the ones I don't recommend, I don't like to inject fat into the lips because it can cause clumping, and if it does clump, it's very hard to fix. So I don't like that as an alternative. You can use implants just like breast implants, silicone gel-filled lip implants. And just like breasts, they can get a fibrotic capsule around them, which causes them to be stiff. Unlike fat, you can remove them. Sometimes it doesn't look as good as you'd like. It can look a little deflated even. And if they do get stiff, they look funny. You can feel them. It makes your lips look weird when you're talking. So I don't like that approach either. So that leaves me with alloderm, which is dermis from cadavers. It's something that plastic surgeons have used for other treatment modalities for a good 10, 20 years, if not longer. It's been around a long time, long history of safety. It's not going to cause allergies or get rejected. It's basically the alloderm. It comes in different sizes, shapes, and thickness, and I choose the one that I think is right for each patient, and put it in with small little incisions on each side of the what we call the commissure, depending if we're doing both upper and lower. Mainly just do the upper, sometimes lower. Obviously swelling for several days to 10 days, but other than that, it's a very patient-friendly procedure. Doesn't get stiff and has good longevity. So that's my preference if I'm doing lip augmentation. Some patients can benefit from a lip lift, which has been called all sorts of different things on Instagram by the younger doctors, like Cupid's lift or whatever, something like that. It's a lip lift. Lip lifts should be done on a deeper plane than just the skin. That is certainly a point that I'd want to emphasize for younger doctors. So you want to check with that. But other than that, I do disagree with some doctors. I think it should be done in accordance with Leonardo da Vinci's principles of aesthetics. Yes, way back then he came up with these principles. It's a 2/3, 1/3 relationship between the upper lip and the lower lip and chin. If you get too far away from that 1/3, 2/3 relationship, it starts looking contrived, overdone, piggy almost. So you can't do that on everybody. I'm more selective than I guess some surgeons are who advertise that they do it on anybody. So I would disagree with that. Well done, well planned. The scar is hard to find, and some patients we do use an ablative CO2 laser several months later to even make it more hard to find, but that's a very nice procedure in the right patient. Obviously, you can do injections, but if you do, you've got to be forewarned that a good percentage, about 30% of patients, are going to get lumpy, bumpy results because you bleed a little bit. There's a lot of small blood vessels in the lips, and when you eject, the needle hits it, and you get a little bump. It's just a little bleed. The bleed bumps, which are fairly common, can take a while to go away. So if you're going to do that, you have to be aware of that. And obviously, it doesn't last that long, and can get to be expensive over time. So take all that into consideration if you want to go that route. And I hope you found this to be informative.